Thank you so much for that lovely introduction, Alexandra. I should say that this is work which Alexandra has been incredibly influential in us putting together. It's quite a large collaborative team, and as part of some of her additional work during her master's, she was really supportive of this. So thank you for that invitation. So I'll tell you a little bit about myself just to kind of set the scene. So as Alexandra said, I work at a business school, but my background is in psychology. And in particular, I'm interested in how you can use real world data to understand how people behave in the world. So I use a lot of digital footprints, like how people spend their money in collaboration with banks, also looking at how people engage online and trying to think about ways in which we can infer behavior in natural settings. And this is really a truly interdisciplinary project. So we have a team of sociologists, people with backgrounds in maths, people from the School of Demography, Social Policy. So I may not know all of the answers to questions that you might have. For instance, I'm not formally trained in demography, but I will try my best on any questions that you have, and I'll try and get an answer to the things that aren't in my expertise. But I wanted to begin by telling you a little bit about the inspiration for this project. And this all stems from a research grant that my former PI, Aaron Reeves, who's a professor of sociology at the LSE. He's just left the Department of Social Policy and Intervention at Oxford, but he was also a professor. He's had this 5-year project in the making, looking at the nature of elites in the UK. And it turns out that there are some really interesting data sources that you can bring together to try and understand the formation and maintenance of elites. This is Aaron's book, which I wanted to give a plug to because I've really enjoyed reading it, and it's helped me to learn about parts of the project that I wasn't directly facing. And the ambition, along with Sam Friedman, who's also a sociologist at the LSE, was to create a catalogue of elites in society. And it really is something that has such impressive scope and breadth, both temporally and in terms of the cross-section of society. So I'm just going to flag a couple of the projects just to sort of set the scene of what we've all been up to for the past 5 years. So one recent paper that came out a couple of years ago now was this paper with a historian, Eve Worth, and they did some really interesting work to use data from Who's Who, which is sort of the elite Bible of Who's Who in the UK. And in addition to people who are seen as being important socially, there are certain people who are always admitted. So for instance, if you're an MP, I also learned if you are a fellow of the British Academy. So if you have any colleagues who are academics in the UK, it's a very prestigious honour, you will automatically be put in here. And they've done some really interesting analysis to see how old girls' networks have changed across time, sort of a play on the idea of the old boys' network. They've also conducted, impressively, 140 face-to-face interviews with these elites and done more qualitative work as well, and trying to understand how people identify. A lot of these people don't think of themselves as being elite, even if they have positions of power and lots of wealth. They often think that that is a term that doesn't apply to them. I've also done some interdisciplinary work as well. So I mentioned Eve, a historian. I come from a very quant background, and we managed to access some really cool data from all the people who have matriculated from Oxford from very far back up to about the 1970s. And we had lots of self-reports of what their mothers and fathers did across time, and we used machine learning algorithms to see how class structures changed across time and the benefits of having a parent as an educator, particularly if you're a woman. And we've also thought about the corporate space as well. So along with Aaron and Charlie, who are also part of the project we'll talk about today, we've done work to look at every company that exists in the UK. Turns out we have a great register called Companies House, which registers all of these individuals. And we looked at the impact that COVID had on disrupting elite networks versus perpetuating them. And as you might expect, it turns out it perpetuated them. But what I'm going to talk about today is something which I think is fundamental to all of this, which is the extent to which wealth is associated with health. And thinking about whether the inequalities that relate to how much money you have and how long you live have changed across time. So we only have limited data really to understand this question. Often when I tell people in Warwick Business School that I'm looking at the relationship between wealth and life expectancy, the response is sort of, well, obviously there's a relationship there. But actually it turns out it's something that's quite difficult to look at across time. So this is a plot from the Financial Times. The title is a bit misleading because they're not actually looking at how much money people have, but they're looking at the local authority where they live and seeing people who live in poorer areas versus people that live in more expensive areas have different life expectancy. Of course, the two are correlated, but particularly in certain areas like in London, you see stark differences. So I heard a statistic the other day that, I don't know how familiar you are with London, but Kensington is a very expensive area. It's in the Royal Borough of Chelsea and Kensington. And it turns out that the difference in life expectancy between the north and the south, very close, is more years than the north and south of Korea. So within small geographical spaces, you can have this variation. We've also got this sort of data from Eurostat. So we're looking here at the difference between people who have lower levels of education, higher levels of education in the life expectancy. So we're seeing this sort of gradient and how it changes across time. But again, it's a very small snapshot. So we're looking from 2015 to 2017. So it's not really giving us a sense of how these things change across time. Sort of jittery. And we can also see that they're persistent as well. So this is some evidence suggesting that these might be growing across time in some places. So again, this is looking at people's level of education and how education has, the relationship between lower and higher levels of education and life expectancy change across time. So for Sweden, we can see that there's a bit of an increase, but for somewhere like Switzerland, it's more constant. But again, these are sort of short term, and we're not really measuring wealth, we're looking at education. So something that's correlated. Turns out historical data on health inequalities are really rare. So here we can see life expectancy in the UK. The sources are World in Data. And we can see this really constant line here. And then we start to get this uptick. It seems to coincide with germ theory becoming more prominent. But we can see that most of the gains have been in looking at infant mortality. So when we start to look at more recent data, the data don't go back before this, we see that there is a steady incline, but not quite as extreme. So it seems like the gains have been coming from this end. And crucially, a lot of this is at the national level, the national level. So I think this tells us a story that's fairly non-controversial. The first is that people who are poor in society seem to have poorer health outcomes than people who have more money in society. And until now, we've only really had cross-sectional analysis. We haven't had a longitudinal analysis of the relationship between wealth and life expectancy. But why do we think that there might be a relationship? So if I go back to my colleagues at Warwick, intuitively it feels as though there should be a relationship. And I want to spend the next few slides talking about some of the formal theories, trying to unpack this. So the first theory is fundamental causes. And if you've not read this paper, I'd really recommend that you do so. It's a really nicely written introduction to this idea. Essentially, the idea is that there are just fundamental reasons why individuals with fewer resources experience poorer outcomes. And the key idea is that there are multiple disease outcomes that are associated with health. And all of these things are correlated with lower income. And also the idea that this is mediated through risk factors. So if I'm somebody who has lower wealth, I'm also likely to be somebody who has poor housing, where it might be able to read, or lower levels of education, which means that it might be hard for me to make informed decisions or access healthcare or choose nutritional food to feed my kids. And it's also harder to avoid these scenarios where I might be exposed to pathogens. It's just a more risky environment to be in. So the idea is that across time, even though the specific risks might change, so it might be cholera, it might be smallpox, we might eradicate certain diseases, there'll always be some association between how healthy I am and how wealthy I am. And I think this is a really nice quote. The first part of it, medicine is a social science, is really capturing this idea that so much of our health is associated to the world in which we live socially. And politics is nothing but medicine at a larger scale. It's this idea that welfare is really important and understanding how policy impacts well-being. But a lot of these intuitions are really hard to measure. So intuitively, fundamental causes would suggest that we should just see at any time point there should be an inequality. But it's hard to tell if that's true. And if it is true, how it's changed across time. Are these growing? Are they shrinking? Are they staying the same? Fundamental causes would think there would just always be this difference. There are two prominent snapshots that have suggested that at different points in time, though, we do see a relationship. So the first is by Chadwick, a Victorian sample, looking at average life expectancy in Liverpool, which is in the north west of the UK. And they looked at sanitary conditions for the labouring population and found these differences depending on people's occupational background. And the Whitehall study as well. Whitehall is the area of government in the UK, so lots of civil servants were involved in this really influential study looking at the nature of their jobs and long-term outcomes. And more recently, we've got this paper from the Lancet Public Health, which again looked at the extent to which local authority areas were deprived or not. So they're not directly looking at individual outcomes, but they're doing a nice job of looking at the relationship between deprivation of poverty, unemployment, and education, and seeing how it's changed across time. So the lines tend to be quite parallel, but you do see there's a bit of a narrowing in some of these, such that the most deprived don't seem to be making the gains of the least deprived. So this gives us some evidence that there is a relationship across time with these snapshots that we're sort of trying to piece together like a cubist painter. However, this is a bit of a spanner in the works for a lot of this work. It's something called the peerage paradox. And this is an observation that for much of the past, we go way back to the sort of 18th century, peers who have a lot of influence, they're members of the House of Lords, they're aristocracy in the UK, didn't seem to have life expectancy that was that different from the general population. This is puzzling, particularly if we're thinking about fundamental causes. Being able to explain this puzzle is something that a lot of scholars have talked about. So let me show you what I mean. So here we have data showing the life expectancy for the general population going from the 1600s, so sort of Henry VIII's time, all the way up to Victorian era in the 19th century. And it's pretty flat. There's a bit of a dip, but we certainly don't see the gains that we see subsequently in the 20th century. These dots are from Hollingsworth, and they superimpose the life expectancy of members of the House of Lords. And what we see is that it's pretty well mapped on. And then we see an uptick. Something's happening here. There's an inflection point. Now, I should say that my colleagues, Charlie and Aaron, have done some very interesting work, which is forthcoming, which analyzes this. And it looks as though actually there might be some issues in the analysis. But nonetheless, we do still see, I think it's not controversial to say that there is a growing effect here. So we have sort of parallel here, and then there's an increase in the gap. So it seems like the inequalities are growing. And if we think about how we might explain this, Angus Deaton is a good place to begin. In his fantastic book, The Great Escape, for which he won a Nobel Prize in economics, he talks about this relationship. And essentially the idea is that it's not just about the fundamental access to various things, but actually what's really important is how innovation shapes life expectancy. So what you might see in this plot is that you might see that there are certain innovations that happen, which means the inequalities grow. They don't necessarily impact the life expectancy immediately of individuals in the dashed line, but across time, one would hope that they would benefit from those and the inequalities would close again. So innovations were responsible for the better health of the peerage and the royal family by the end of the 17th century. Now, Fogel, who was a predecessor, also Nobel laureate for his work on this topic, would focus on different things in explaining this paradox. So instead of talking about innovation, he would talk about the fact that there are really specific reasons why these peers weren't living much longer. The first one would be that those peers drank a lot more alcohol than the general population. They also had a lot of food that was salted, and wealthy adults ate well, but their children didn't necessarily, and that might be dragging it down in these families. And also the types of diseases that people are dying from change from things that are spreadable, like measles, tuberculosis, and leprosy, to things that were more chronic. And those aren't associated necessarily with diet. We now know that's not quite true, but the association is potentially weaker there. So the idea is that there are these really specific reasons why wealthy people were living these lives that meant they weren't particularly healthy, and then these health gains happened later on. Might be a little just so, but that's the thesis. Now, the problem with the work that we've discussed so far is that it's really hard to test out these competing theories or think of alternative theories with the data that we have. We have these snapshots of things that kind of measure people being wealthy, but it's actually a proxy for maybe having access to elite circles or their education. We kind of have a measure for life expectancy, but we're looking at lots of different pieces put together. And it's as though you've got jigsaw pieces, but sort of for different jigsaws. They don't fit together nicely. We're also often using regional deprivation as a proxy, which is fine, but it's not a direct measure of wealth. And we often have a small n problem as well, where we're looking at maybe parish records and things like that. And when we think about peers in particular, you've got a really unrepresentative sample, because to elevate the peerage, you sort of by definition have to have reached a certain age and a certain prominence. So we have all kinds of issues there. So this led us to begin on what has been an ambitious 4-year project so far, and still ongoing, to think about how we can develop a catalogue, not of some individuals, but of the whole population of the UK, from Victorian Britain up to the turn of the millennium. And to do this, we've used deep learning and optical character recognition to combine a really detailed analysis of health inequalities in the long run. I'm going to introduce you now to the probate registry calendar. So in the UK, sort of to my surprise at the beginning of the project, we have an incredibly rich source of all the wills that have been probed in the UK from 1858 to 1995. There are very, very few exceptions. Members of the royal family, for instance, are not included. But you can get into this in 2 ways. The first is via wills. So anybody who leaves some money behind will be represented here, and that can be big or small. The second is through administrations. So if you didn't leave a will, but you had a certain amount of money, it fluctuates across time, but it's always about £5,000 in today's money, so just a bit more than €5,000. So a fairly modest sum, not crazy sums, you will be put into the administrative calendar. And there are some really prominent people in here. So just to make it clear that I'm not just saying it's only the royal family, you can see Charles Dickens. He had £80,000 even back then, so a good sum. Charles Darwin is in there as well. You can see who he left his money to and where he died. Virginia Woolf as well, with her married name in there. This is Beatrix Potter. It wasn't the clearest photo, but I liked that there was a dog in it. We've got Alan Turing, who was the code breaker, really founded the discipline, one of the founders of artificial intelligence, with his great paper on the Turing machine. And we've got Winston Churchill as well. So you can see he left his money to his wife, Clemmy. But we also have really normal people in here as well. So I've just picked out at random some individuals here. I found somebody in Victorian Britain called John Croxton. He was a labourer who died in the Victorian era, and he left £5 to a farmer. Must have been a buddy or something. So that's about £600 today. Lionel Abbott from the early 20th century was a commercial clerk, and when he died, he left £65 to his son. And then we've got Susanna Childers, who in 1964 left about £200 to her bricklayer son and homemaker daughter. So you've got the whole spectrum of individuals who have money, big or small, to leave to others, and we can see who they've left it to as well. So let me tell you how we did this. The first thing we did was rely on the website where you can look up these things. They've changed it now, I'm afraid. Not because of us. We were very friendly in our scraping and let them know what we were doing, but they used to have a wildcard search. So you could search all the different combinations of letters. And I should stress that it's very important when you're doing this kind of thing to be very friendly, to have user agents with your email address on, and to make sure it's within the normal traffic and adhering to their robots.txt guidelines. But for each year, we set up a virtual machine, and we sent requests on average 10 seconds, plus or minus the noise. And we saved these to an AWS S3 bucket for processing. This resulted in 1 million photographs of different images from these wills, which exist in Kew Gardens, which is where the records are stored. Apparently, that's 100 meters if you stacked it vertically. So you can imagine paper going from the start line to the finish line. That's how much paper there is. And each of these pages represents an image of the data. So then we started the arduous job of turning all of these images into data or doing text cleaning. So I'm going to show you a standard year. So this is 1879. First thing you can tell is that the colors are inverted, and it turns out optical character recognition does not like that. So the first thing you do is you ask Python to measure the number of black pixels, the number of white pixels, and if one is higher than the other, you invert it. Then you want to convert it from grayscale to binary black-white. And then you might see this little jitter here. So you work out the page is skewed. There are some algorithms that get the sense of what the lines are by running regressions. You neaten it up. You identify any blobs. There are lots of ink dots where people are using, before we have biro pens. You do some margin detection to try and clean up the margins. This is the step that bothered me the most, and it took us all a very long time to teach the machine what is handwriting and what is text. But eventually you can do it with lots of perseverance. Although after this, about a year later, Amazon introduced something that you could have just paid to do it, but it didn't exist when we did it, so we had that code, which is nice. We perhaps should have patented it, but we didn't. And then you can see these speckles, which I've turned red, and you can get rid of those as well. So you really just want to clean everything that might confuse the OCR. Then you create bounding boxes around first the words, then the paragraphs, tell them to ignore certain blobs, and then helped us with this. They had to create a training set every few years, the structure. So you have to have different parameters for each of these things every few years. So they were transcribing a random subset of pages. That was our training set. So thank you so much to them. Okay, let's just do it. Next up is the text extraction. So here we have an individual. We've gone right from the 19th century in the last slide. Now we're in 1990. And we've got to turn this into something the machine can read. So we used another AWS service, Amazon Textrat. It's good, but if you read this, there might be a few mistakes that you can identify. Luckily, we didn't have to read these by hand. You can use something called OCR Fixer, which is a package in Python, and it uses BERT to infer that that probably is meant to be square, and that probably is February. So it does things like this that we would just notice right away and fixes those. And then we extracted using regular expression. So we can see that this person is Josephine, died in 1990, Cambridge, wealth of 100,000. So we can go from all of these pages into a flat file CSV. Okay, these are the probates that we extracted. We managed to get 18 million records. You can see it gets a bit dodgy around here. That's because the files get quite messy. So it's not that we're having fewer people in the probate records, but instead we had some issues with extraction because the pages do get weird fonts and they start to smoosh things together more to be more efficient. These pages at this end are much easier to read. Just to give you some validation of any strange stuff that we found, we here have the amount of money that people had when they died, and this is looking at people who had £0 or negative pounds, so when something has gone wrong. You can see the numbers are quite low, but I think over, you can see that there is a spike here because, again, it's quite difficult to read those pages, but still it's quite small. Of millions of people, we've got thousands. We also used APIs to infer people's gender. I appreciate that if you're doing this at the individual level, there are a lot of complications in assigning somebody a gender, but over large numbers of people, on average, you get a good signal. So, for instance, George is very likely to be male, but Anne is very likely to be female. And we used this to see the relationship between wealth at death for men and women at this time. First thing is that there are a lot more men at the beginning leaving probate than women, and that gap narrows. There are also some legal reasons for this. For instance, if a woman was widowed, she remarried, there were issues around whether she could inherit. The idea was that it should go to the children rather than the new husband, because her property was his property. That changed across time. But we can also see that there is this gender gap in amount of money for the people who are in the probate, and that this narrows across time. I'm not quite sure what's happening here in this year. There's a very wealthy lady that died, but perhaps I should look into that. And this means that we're also able to see who's in the top 1%, the top 5%, the top 10% of wealth. So on the top row, we've got the top 1%, what would get you in there. In 1980, it's about £100,000 for women, and for men, quite similar by the end of that period. And we can also look at this across both genders. So by looking at the number of people who were in the probate records relative to the general population, this isn't the top 1% of just our data, but is extrapolated across everybody who died that year. Now, after we did that, the next thing we wanted to know is how old people were when they died. Unfortunately, the probate records don't tell us. They tell us the date of death, but they don't tell us how old the person was. We collaborated with the most extraordinary charity called FreeBMD. They're part of a bigger group called FreeReg, and they're one of the first ever crowdsourcing projects. So they've been going since 1998 online, and they look at all of these images for birth registries, deaths, marriages, you name it. And they have banks of volunteers who give their time to code up. Coding makes it sound more sort of computational, just to transcribe what's on these pages. And they've done almost 400 million to date as of September 24. They sort of go from backwards in time and they do an extra year. So they're currently up to about 1991. This is what the pages look like. So there's a lot of dense text. This is somebody from 1919. And you can see the person who transcribed it, J.S. Coleman. If you click on J.S. Coleman, you can learn more about them, how many pages they've transcribed, what proportion have been validated, if they're good at their sort of task or not. And we collaborated with them to purchase this data. They were very generous to let us use this data. So we had all of this. We didn't have to go back and do the OCR for this, which would have been very stressful. So we can tell that this person, Burroughs, Mary, died at 95 in Ipswich. We don't know the date of death, but we know the quarter of death. So these binders are for each quarter. This is what our data look like if we just look at that data without joining it to the probate. And it's reassuring. It looks like the figure we saw earlier on, which is good. You can also see these dips for Spanish flu and the Great War. And you can see this uptick, particularly in infant mortality after the NHS was introduced, which makes sense. So the next step was to combine these together. Here is an example of some of the probate data that we extracted. And what we want to do is we want to combine this with our data that we've purchased from pre-BMD. So 3 of them had a death in Q1 of 1940. So we can look at them up here. And 1 person died in Q2. That should actually be Q4 of 1939, but you get the idea, a different period. If they have unusual names or they're the only person, it's nice and easy. You just find green with green, red with red, and you do a nice simple join. But of course, things aren't always that simple. You often have people with the same name. So in that scenario, let's say we had 4 people who died in Q4 called William Ackroyd. First thing we would do is remove anyone under 16 because they wouldn't be in the records. Second thing we would do is if we still have multiple matches, we'd match on middle name. And then if we still have multiple matches, we would match on the location. So RiceLip, we can do a lookup table, it's in Middlesex. If we still have multiple matches, which is very unlikely and quite rare, then we wouldn't have a match. So here we would say this person was 73 when they died. Do we see any strange stuff? So this is a plot looking at everybody who was aged 110 or older, according to the transcribing that the volunteers did. There are some, but I think over the many millions of people, there were 700 or something. So we just exclude those. This is what our data look like. So of the 18 million probate records, we were able to match about 62%. We had multiple matches or no match for 20% each. The no match was typically an OCR error where the name was just extracted incorrectly. But there were quite a few that we had research assistants look through and they just didn't seem to be there. So we don't know what's going on there. And this is another way of looking at it. You can see our detection, our matching drops across time. And you can also see there are these little groups. So this is when the pages were presented in one way. This was a less good way to present the pages. And you can kind of tell just by looking at it where there's been a structural change. Okay, so after about 3.5 years of lots of cleaning, we're finally at a place where we can make some life tables. And we've got our data set of 120 years with millions of people in it. Because of course we don't just have the probate records, but we can also infer that the people who are in our data, but not matched, with some probability that they had wealth of less than 5,000.
Just to make sure that those people who do not have a will, who do not give money to their kids or whatever, are they still in the data set or not?
Yes, we do robustness checks because we don't know what their wealth was, but we include them as the, we call them no wealth, but of course they had some wealth, but right. Yes, we include them as well.
So if they're not in the will data set, but in the other data set, you infer that they are at 0.
Yes.
Okay.
Yeah. So this data set has a visual, we can represent the classes and the working classes because, as you said, from the aristocracy, from Edwardian Britain to the middle classes, will be in our probate data, but some won't. But we can also infer people from working class backgrounds who will be in our death data, and we can infer that because they're not in the probate, they didn't have a sufficient sum to leave behind. So with the exception of maybe the second picture, where there are individuals that conceivably are still alive today, for a lot of these individuals in the photos, they will be in our data somewhere, which I think is okay. I'm going to tell you about the demographic now. So we try to make life a lot of different targets. So we have a yearly analysis for every year up to 1991. We have rolling windows of 1, 3, 5, and 10 years, and have ages which shows the table as well. So we close the life table at 95, 100, 105, 110. And then we also assign different categories for wealth. So we've got the top 1%, which are not 1% of probate data, but inferred across the whole population, whether you're in probate or not. We also have these weighted to account for the fact that men are more likely to be in probate than women, and they have a different life expectancy. Then we've got non-probate weight ages that are weighted, and then all of the data. And he's really led with this. He's at the demography school at Oxford, and I have learned a lot from him about this. But any very technical questions, I might have to direct the expert. Behind all of this, we've got over 72,000 life table attempts. And all of the code is currently being collected here. It's not currently public, but it will be very soon once we ensure that we're happy with the analysis. Otherwise, these are very standard methods in the field. We follow a lot of the state-of-the-art literature, and we haven't done anything too funky here. So it's all very much off the shelf. And we've also compared our estimates to the human mortality database as well, and they seem to align well. Okay, so you've been incredibly patient. Let me tell you what we've found so far. This is a plot looking at the mean age of death. On the left, we've got men. On the right, we've got women. You can see what you would expect. We see this, and we can see that the difference, that the data are changing across time. So here we've got the Victorian era, first half of the 20th century, second half of the 20th century. So the ages are moving in this direction. We can then look at age of death by the quartile of wealth. So the top line here is the top 25th percentile of people with wealth. Then we've got the 25th to 50th percentile, and then the third and the fourth. And what we can see is that these gaps seem to be closing across time. So particularly once you get up to here, there's a lot of overlapping here. This is the mean, this is the median. So it seems like inequalities are narrowing across time. Here we've got the weighted, which is accounting for the fact there are more men than women in the sample, that's in orange, versus the raw unweighted data. And again, we can see on the top, we've got life expectancy at birth, life expectancy given that you've made 50 years old. So this is getting rid of infant mortality, for instance, and then life expectancy given that you were 80 years old. So this is how many more years you would expect to live, given that you're already 80. Now, if we look at the age 50 and the age 80, split by wealth, on the top row, we've got people who are already age 50, and the bottom, we've got people who are already aged 80. And this analysis was important because one of the concerns is that if you've already reached, how do I say this? Your wealth might be contingent upon the fact that you lived long enough to accrue the wealth. So we went to 50 and 80 because presumably, certainly once you're 80, in this period, you're drawing down on any savings that you have. You're not amassing more wealth. So it's a nice control to ensure that we're not just capturing the fact that your wealth increases across time. And again, what we see is that the top 1% are living longer. The blue individuals are living longer than the general probate sample. So these are people who had some wealth. They're in orange. And they're also living a little bit longer than the individuals who were non-probate, who had no wealth. There's a lot of overlap between the orange and the red, the all probate and the non-probate, but we particularly see the top 1% are living longer. But the gaps do seem to be closing across time, even for these older individuals. So we've done some validation checks as well to look at the gender imbalance. So this is controlling for differences in men, in women, and for everybody. And this is assuming that people live to age 20. So we're getting rid of any individuals that didn't, that died prior to age 20. And again, we can see that these gaps are closing. And in particular, for a lot of these individuals, being in the probate, so having some wealth, 5,000 or more, in today's money, isn't giving you an advantage over the non-probate people. It's only the top 1% that are living a bit longer. And by here, it's a super small, negligible difference. Okay, how are we doing for time? Okay, we're bang on time. So let me give you an interim summary of what we found. For both men and women, and for all of the years in our sample, life expectancy is better when you have more money. However, we find that these gaps are narrowing over time. And in particular, we see since the 1940s. Now, this is no coincidence, we argue. We still have more robustness checks to do, but our prior is that this is coincidentally around the time that Clement Attlee's government introduced the welfare state and the NHS is established. We think that this is a very important driver here. And in the earlier parts of the sample, the gap in life expectancy at age 20 between the 1% and everybody else was as wide as 17 years for women and 16 years for men. So big differences. And we see that the effects are more pronounced for life expectancy at older ages as well. So, sounds like good news. These gaps are closing, things are becoming more equal, wealth is less of a determinant of how long you live. Well, we wanted to do some follow-up tests to really unpack whether this is the case and to try and understand who had the right idea. Is it Warwick's Vogel approach, or Deaton, or fundamental causes? So this is more exploratory work than the stuff that I've presented so far. So I'd be very interested to hear your take, but this is very much work in progress from here on. So what we've found so far supports fundamental cause theory insofar as we're still seeing these gaps. The extent to which you have a long life is also affected by how much money you have. So this sort of supports the central premise that health inequalities are resistant to some extent to innovation. It's not necessarily about the disease in and of itself, it's about the social conditions, and these things can be associated with poorer outcomes. So we do still see that people who have more wealth, and therefore presumably this is correlated with power and prestige, are living longer lives. And this, although not conclusive, supports the idea that these things might be at play. It also suggests that interventions can have an impact. So this departs somewhat from the fundamental causes idea and really touches on the work of Deaton, thinking about innovation and intervention as sort of narrowing those gaps. Maybe you see inequalities expanding initially, but then everybody else's catches up. And we can think about the NHS and the welfare state in particular as being things that could have driven this, potentially. So it suggests that we can do certain things to improve these health inequalities, which is a lot more optimistic. And it sort of challenges this deterministic theory that we saw on the previous slide, which suggests that structural interventions aren't going to disrupt these fundamental differences. It seems as though something's going on here that is changing that relationship across time. So it sort of tests this idea that what is fundamental in fundamental causes, and it sort of suggests that there is a dynamism to this, so things can change across time. We've got to think about broader social factors, but also the extent to which we can intervene. That's quite repetitive, whatever it is. So for Deaton's Great Escape, this is looking pretty promising. The idea that this innovation that we've had in terms of policy, in terms of public health, campaigns to stop people smoking, to eat more healthily, these things could all be helping initially people who are very wealthy, who get the knowledge first. So for instance, with smoking, we know the people who stopped smoking first were people from higher socioeconomic groups. And then there's a sort of catch-up effect that sort of trickles down. And the idea is that we can use public health and policy to try and minimize these gaps. However, we didn't want to just stop there with the data. We wanted to think about family trees. So we have now undertook using another data source online, which is also to the credit of some great volunteers as well, which I'll tell you about in a minute. Don't know if any of you have used WikiTree before. I personally wasn't familiar with this, but it is the largest genealogical tool that you can use that's open source and free. And they have an API which has 36 million records globally as of last year, October. And their ambition is simple. They want people to be able to create their own family trees. And if you have enough people making their own tree, eventually you have one global family tree. That's their end goal, ultimately, to have something that links up. It has 36 million records, but this is global. Lots of them are in the US. I couldn't find the exact number for the UK when I was trying to look this up last night. But there's a decent chunk of people who are on there. Lots of people who aren't. I personally haven't inputted my family information. I don't know if any of my relatives have, but a good chunk of people are on here. So what this means is we can take our data and we can take our target individual, and what one of my colleagues, Paul, has done is he's looked for any individual who has another relative on there. So they're not their own single node, they have someone on there. And this is a fictitious person who has 2 parents, 2 grandparents. But we searched to see if they had any parents and grandparents. And this might be patchy, maybe your dad's not here, maybe your mum's not here. This person didn't have the maternal grandparents, but we can make these connections. And then what we can do is use the data we already have to look at the age of death and wealth at death. This allows us to do 2 things. The first thing it allows us to do is to see the age that your parents were when they died. Now, part of that could be related to the social conditions in which you live, but a strong component of that is going to be genetic. So we can control for the age and use that as a proxy for the genes of the parent. But the second thing we can do is we can use the wealth that your parents had as a proxy for your upbringing and the amount of money you had as a child, and particularly your grandparents, if we have that as well. That's going to be tied to your early years wealth. And it would give us a connection between not just how much money you had when you died, but how much money you were sort of born into. Obviously, we don't know the bank balance of your parents when you were born, but this gives us something that's approaching that. And the preliminary analysis that we have done on this shows something quite interesting. So if we use wealth, your parents' and grandparents' wealth at death as an approximation of affluence in childhood, we don't replicate what we found about one's own wealth, which is that inequalities are shrinking. We actually find that inequalities are growing across time. So let me unpack that. What that means is that the amount of money I have when I die is less likely across time to predict how long I live. So my wealth matters less. But the amount of money that was in the family when I was a child and in my formative years seems to be more important across time. So it suggests that those early years are particularly important. And we can think about that in terms of the types of diseases that one sees. So you can imagine in the earlier years, the things that were more likely to be fatal might be things that are related to the context in which I'm living in a very immediate way, maybe sort of short-term illness or short-term disease that I've contracted, followed by mortality. Whereas this suggests that these formative years, these building blocks, are affecting the extent to which we're healthy as adults and how long we live. So this relationship seems to be growing. So my personal wealth is becoming a weaker prediction of how long I live. But the wealth that my parents and my grandparents had when I was growing up is becoming a stronger predictor. Now, of course, these two things are highly correlated, but when we control for these things, and even when we control for the age at which my parents lived to, we find that this is growing across time. So what does this all mean? Well, we're certainly not done with the analysis. We have more robustness checks to do before we're ready to sort of put pen to paper. But if we think about Fogel's work, it really supports the idea that the long-term impact of family wealth and lineage is important, and it's continuing to be something that is impactful. So where we come from really matters. From the perspective of Deaton, it does also support the idea that innovation and things that have changed with respect to scientific research, which affects the type of interventions we have, knowledge sharing, these innovations have helped to improve public health and shrink, to an extent, not completely, the relationship between wealth and population health. And I think it shows in a really interesting way that there is this tension between the two theories. And the next steps are to think about ways in which we can look at maybe structural break tests, for instance, to see how changes in the environment stack up against the changes that we're seeing in the data. I guess the main conclusion that I want to leave with you is that we see that wealth is still a really powerful predictor of life expectancy, but there are structural changes that seem to align with our priors around when one might expect that there are differences. Another structural change that I didn't mention that we really start to see, for instance, infant mortality really being driven down, coinciding with germ theory being adopted, which is something that sort of trickled down again with respect to people adopting those lessons. So it suggests that we can gradually level the playing field in some respect when we look at wealth today, but those childhood years from the early speculative analysis still seem to be really important. And I guess if I was going to leave you with any takeaways, I was in a social policy department, so I often like to think about these things, but it suggests that these targeted policy interventions are really important, and it's not just about economic growth. And we need to really think about what was causing these different changes across time, and that's our next phase of work that we're excited to take up. But I guess the key takeaway is that interventions and innovations do seem to have the power to shape these differences across time. But as we continue across time, it seems like those formative years are becoming particularly important in shaping our longevity. With that, I'm going to wrap up. But before I do, I want to say a huge thanks to my co-authors. You know Alexandra, but we also have Linda, Paul, Charlie, and Aaron. And I'd also like to thank our funders as well, the British Academy and the ERC, who funded the project more generally, and the Leverhulme Centre for Demographic Science at Oxford as well, who have funded a lot of this project too. Thank you so much.